the community that you represent obviously has its own unique challenges in dealing with the HIV epidemic. So tell me, how is Indian Health Services involved, and what are those unique challenges?
Thank you, Joy, and thank you, everyone. It's really a pleasure to be here with everybody. We looked through our Indian Health Service archives and found that this is probably the first time ever that the Indian Health Service has been engaged in the plenary session here at USAC. So really appreciate being here, this first opportunity. First want to express our gratitude to our sister agencies, CDC, NIH, and HRSA, for partnering with us on this national initiative. And with Paul and his team from INMAC, we look forward to building upon the relationship that exists and creating an even better partnership for the benefit of our American Indian and Alaska Native patients. For those who don't know a lot about our agency, we're relatively small. We fall within the Department of Health and Human Services. We serve an American Indian and Alaska Native population of about 2.6 million across 37 states. And that's 573 individual, independent, sovereign tribes. As I travel throughout Indian country and meet with tribal leaders and our urban Indian organization leaders, it's very clear that HIV is a public health issue. It is on their radar screen. But it's not clear that it's at the level of magnitude that is commensurate with the issue at hand. So I think that what we need to do from the IHS and from our tribal and urban partners is to raise the level of awareness of the importance of HIV treatment, prevention, diagnosis, not only for HIV, but for Hep C and other sexually transmitted infections. The CDC data tells us that from the year 2005 to 2014, that American Indians and Alaska Natives are one of those demographic hotspots. We've talked a lot about the geographic hotspots, those 50 communities, but we haven't talked a lot about the demographic hotspots. And our American Indian and Alaska Native population is one of those demographic hotspots. Our young gay men have a rate of infection that's increased 63% in that time period of 2005 to 2014. And we've also seen our overall HIV rate increase by 19% in that same time frame. In addition, when we look at data for ethnic and racial differences, we've had survival rates between the years 1998 to 2005 display that Natives have the lowest survival rate after an AIDS diagnosis. So as our tribes and our advocates work together to identify those best and promising practices to address these rates and to do it in a culturally appropriate framework, it's vital for us as a federal partner in the federal agency to be just that, to be a humble partner and to listen to and gain information from our tribal constituents, our urban Indian partners, and not necessarily serve as the lead agent. We have many of our tribal organizations like the Northwest Portland Area Indian Health Board, the Cherokee Nation, the Phoenix Indian Medical Center, HIV Center of Excellence, who've been doing this work for decades. And we need to learn from they're really the foundation of our work. And so we need to take advantage of that foundational work and give them the resource they need to move these issues forward.
So, you said the magic word. Has your budget gone up this budget year?
So we have seen a doubling of our funding from the Secretary's Minority AIDS Initiative Fund. Okay. So that's a good first start. But we've asked Congress for a significant increase in the President's 2020 budget as well. And with those funds, we expect to build upon those successes and accomplishments that we've seen today.
Okay. I want to bring Stephen Barrios in, who is a member of the Blackfeet Nation and a co-founder of the Montana Twospirit Society. Stephen is a community elder, identifies as Twospirit. From your point of view, what needs to be done? What does your community need right now, particularly from the federal government?
Okay, well, right now, I think we need to do a lot more education on our reservations and work with our community and our leaders. And this is one of the reasons that we're at the Montana Twospirit Society and the societies that throughout the United States and in Canada to reach our Native youth and our Twospirit men and get them tested. And this is one of the ways that we're trying to eradicate HIV among our Native people. Living on a reservation is so much different than living in an urban area. And we have so many different protocols we go through with our tribal elders and also our council members and working with HIS. As many people know that live on reservations and work with IHS, the confidentiality and stuff. So it's so hard to get our people in there to get tested. So this is one of the reasons a lot of them go off reservation to get tested. So we're trying to make it easier for them to be tested on a reservation. And I've been doing testing on a reservation for the past 20-some years, and also working with people with Hep C, which is another big problem on our reservations. And we are a nation within a nation, so we don't have to really go by the state laws and stuff, so we can have needle exchange on our reservation, which we are doing now. And this is helping get clean needles to our individuals out there to stop them from getting HIV and
And Ann White, I want to bring you in. Ann White is an enrolled member of the Diné Nation. She works at the Albuquerque Area Indian Health Board. Can you talk about the unique challenges for women who are living in your community in terms of getting both treatment, obviously, and also in learning their HIV status?
I think just as Steve mentioned, just reaching our Native women and being able to provide testing and access to health care for our women in our community. So it's really important, and we've been very intentional at the Albuquerque Area Indian Health Board to provide testing not only for HIV but for Hep C in tribal communities. We set up at rodeos, we set up at health fairs, and we have a pop-up tent, and people don't have to walk across a large venue to go to an isolated room. We do testing right there on the spot, and we provide the results on the spot. And we always give warm handoffs. I think that's really important in tribal communities, is that you are just not a number. The impact that HIV has in our community is relative, because anybody who is diagnosed with HIV and that we lose to the disease, that's a loss of our culture, our language, and our way of life and our ceremonies. So it's really important that we reach these people where they are and get them tested and get them into care.
Yeah. Let me get Nick Wagner involved as well. Nick is also Diné, works with Native youth as a social worker and mentor. And so can you talk about, with younger people, getting younger people in your community to take advantage of the opportunity to find out their HIV status, getting treatment? It would just seem to me that it would be more challenging in communities that are already facing a lot of struggles, as we know, particularly with the federal government not always being so helpful. What are the particular challenges in terms of young people?
It's challenging because our education system is antiquated. If we can think about, yourself as a young person when you were coming into learning about gender and what that really means, and sexuality and what that means to you, who were you learning from? What information were you getting? What community did you grow up in? And that's who you learn it from. You learn it from where you grew up. And then, it's limited based on your school system, based on whether you live in a rural area, based on whether your state allows you to learn certain information or not. Education is power, and if we give that power to our youth, they can grow up in a more informed community and in a more informed and empowered sense of their personhood, and taking control of their sexual and gender identity as they get older.
Similar question to you, Kendra Vicente, an Indigenous community activist and an intern at the Center for Native American Youth. For young people, is there a particular challenge in getting people to confront these complex issues that young people are already dealing with in terms of sexuality, gender, and relationships, and then adding to that, attempting to deal with issues surrounding HIV? Is it a particular challenge?
I think, just one of the biggest challenges, speaking from my experience as a cisgender Navajo woman and a Native youth, It's about, we are in spaces that are very colonized, and that, in our communities, we really need to offer support and love and, most importantly, allyship to our LGBTQ Two-Spirit relatives. My work now is really focused on raising awareness about the epidemic of violence against Indigenous women, girls, and Two-Spirits, and that these issues really tell us that we have a duty and responsibility to protect our relatives from both visible and invisible epidemics, to encourage our people to be more sex positive, to make space. And this also means decolonizing our mindsets, decolonizing our bodies, decolonizing data, and creating a future where my generation and future generations live in a world where we protect all of our relatives, both in and out of Indian country.
Okay,
Thank you.
Thank you. And I want to bring in Mate Jim, who is Navajo and a transgender woman working for First Nation Community Health Source in Albuquerque, New Mexico. So let's talk about, because we had a question here somewhere in this area about the transgender community facing additional challenges, particularly in this current environment. And so what are the added challenges for transgender people within your community, within Native communities, and then on top of that, trying to deal with issues of HIV and prevention?
Oh, thank you. I want to say everybody when I answer this. So I have 2 words for everybody. Intentional inclusion. A lot of our Native communities, especially our trans communities, are not included in a lot of the meetings, a lot of the trainings, and a lot of the tables that we sit at on national levels. And we're not included whatsoever. And everybody in this room also, how many of you are including our Native populations in the work that you do? So intentional inclusion is what needs to be happening. And we face a lot of challenges within our trans community. Sitting at the table, sometimes it gets tiring to continually say, let's intentionally include our population. So if we're going to fight the epidemic and end the epidemic, which I know that could happen, you need to include everybody, and not just looking at Native American communities, but also our fellow brothers and sisters who are Native Hawaiian and also Asian and Pacific Islanders.
Thank you so much for saying that. I think it's important because thank you for saying that. Because I think when we talk about inclusion, we tend to talk about only whether the black, white, dynamics, right? But we leave out a lot of people. And I think I'm glad that this was our first panel, because I think it's so important that Native communities are included. And Asian American communities are often not in our left as well. So we have a lot of communities that are not being spoken about. So thank you so much for saying that. I'm going to come back to you for the last word on this panel. And so just ask you, how can all of this be addressed? And will you take that back to your agency and make sure that the voice is louder in terms of speaking for Native communities and including the trans part of the Native community?
Absolutely, and thank you, Joy. First thing I'd like to do is ask those American Indians and Alaska Natives who are here in the audience, or if you work for a Native serving organization, to please stand up. I see a lot of them here clustering. Thank you for your work. Really. So our immediate actions are going to be to take those additional resources that we've received and partner with the National Indian Health Board, the National Council of Urban Indian Health, and to conduct listening sessions so that we can identify those best and promising practices, share, and pull additional information for use by the entire system. So really appreciate everybody who's here, and again, the opportunity to present on behalf of the Indian Health Service.
Thank you so much. Thank you for being here. Let's give this panel a wonderful round of applause. Admiral Wayaki, thank you for being here. Anna White, Stephen Marcos, Kendra Vicente, Nick Wagner, and Matthew Jim. Thank you all. Thank you very much for being here today. Thank you. Let's take another quick break on this panel.
You have to get out in the street, and you have to let people know that I'm not